The medical profession over the years have underwent numerous progressive changes, and the changes were for the purpose of improving the patient care. However, while offering the best possible care, irrespective of all logical decisions, the treatments may appear wrong retrospectively. Hence, there is a lot of growing disrespect, mistrust, and violence against the medical profession, which makes it necessary to understand and follow the ethics. With this note, I, Dr. Sunil Thipne, working as an assistant professor at Pravara Institute of Medical Sciences, welcomes you all and thank you for finding the time and visiting the webinar today. I'm also an author of a book, Beyond Medicine, which includes the sensitive and important aspects of doctors like attitude leading to burnout, violence against the doctors, communication skills, doctor-patient relationship, and the ethics in medical practice. Dear friends, the idea of hosting the webinar on bioethics was conceived just a month back while my communication with Dr. Kutesa, and it was well supported by IMA and Pravara Institute of Medical Sciences. Friends, today we all have joined together for a national webinar on importance of bioethics in medical education and clinical practice. The webinar is organized by Indian Medical Association, Maharashtra State, and Pravara Institute of Medical Sciences, deemed to be university. The webinar is hosted by Indian Medical Association, Shirampur branch, and supported by IMA Medical Students Network Maharashtra and IMA Junior Doctors Network Maharashtra. MMC has granted 2 credit hours for the webinar, and we have Dr. Ravindra Kute as the observer for the webinar. Dear participants, the webinar will be I now request Dr. Y.M. Jayaraj sir to say a few words.
Good morning, namaskar, season's greetings and best wishes from Pravara Institute of Medical Sciences. I deem it an honor to be amidst you today. This is a very unique and innovative program where the teaching university, tertiary hospital professionals, medical practitioners, the students, as well as the junior doctors are on the same platform to discuss a very important and novel topic of bioethics in terms of medical education, health profession education, and bioethics in medical practice and clinical practice, and also bioethics, particularly with a special reference to the COVID-19 pandemic. This is a very unique occasion. I'm indebted to the office bearers of the IMA of Maharashtra State and Shirampur branch. I recognize the presence of Dr. Rajendra V.K. Patilji, our president of Pravara Institute of Medical Science Trust, Dr. Ved Prakash Mishraji, a towering personality in the field of health profession education and bioethics in India. And we are indebted to him for having given us the competency-based curriculum to the health profession education after almost 20 years. I recognize the presence of Dr. Avinash Bandwe, Dr. Ravindra Kute, Manoj Sancheti, Dr. Sanket, Dr. Jayalal, and Dr. Ravi Vankadkar. I also recognize the presence of Dr. K.D. Chavan, Dr. Sunil Titme, and Dr. Motilal, and all other fellow participants and delegates. Once again, I deem it an honor for Pravara Institute of Medical Sciences for having associated ourselves with IMA Shirampur branch. I congratulate the office bearers of Shirampur branch for having come forward with particular novel idea of having a unique national webinar on bioethics. So I look forward for fruitful deliberations where there will be 3 lectures in the first session and 7 to 8 lectures in the second session. So by the end of the day, I'm sure we'll be having more information and knowledge, and also our horizon of thinking and action plan for the bioethics will enhance by this particular national webinar. Looking forward for fruitful deliberations. Once again, we are indebted to all the office bearers of IMA and the office bearers and the management of Pravara Institute of Medical Sciences for having permitted us to have this national webinar. Thank you very much. Have a fruitful day. Thank you.
At the end of the sessions, now I request Dr. Y.M. Jayaraj sirs to deliver on topic bioethics in a pandemic, COVID pandemics. Just introduce himself. I think he also don't need any kind of introduction, but because there are 203 participants, I think they are joined, and mostly they are from different parts of the IMA. And I think just I will briefly introduce him. YM Jayaraj sir is the Vice Chancellor of the Pravara Institute of Medical Sciences, deemed University, Loni. Earlier served as a Pro Vice Chancellor of Sri Balaji Vidyapith, deemed University, Pondicherry. Pro Vice Chancellor of Pravara Institute of Medical Sciences, deemed University, Loni. Special Officer at Department of Higher Education, Government of Karnataka. Academic credential at Gulbarga University, Gulbarga, and from 1975 to 2013. Professor of Microbiology and Head of Department of Microbiology, Dean Faculty of Science and Technology, Director of CDC and Development. Overall, 45 years of PG teaching. That is 45 years of significant means it is beyond the significance. The overall 45 years of PG teaching and research experience, guided 15 students for PhD in microbiology, published more than 100 research articles and completed several funded research projects. Totally involved in the quality movement in the field of higher education, academic advisor to many prestigious institutions and universities in the Maharashtra, Karnataka, Gujarat, and Pondicherry, delivered more than 100 keynote, inaugural, and theme-based lectures at the national seminars, conducted more than 500 workshops all over India on quality initiatives and assessment by NAG. His aim to serve and continue to serve the cause of quality education, optimist and total faith in present generation. We can and we will. That is the theme. I think that is the one of the good inspiration for all of us. Thank you, sir. I request you to deliver a lecture on the bioethics in a COVID pandemic.
Thank you, Chairman sir, Dr. K.B. Chavan sir, and all the office bearers of IMA and my fellow delegates. First of all, I'm indebted to the IMA office bearers, especially of Srirampur branch, for having thought it fit enough to coordinate with the Pravara Institute of Medical Sciences for a very unique national webinar on the importance of bioethics, not only to medical education, but also to the existing practitioners and future practitioners. It is also a very unique opportunity, as I told you, that the students as well as the young doctors are also a part of this particular national webinar. With these few words, I would like to say that we were really fascinated and we are lucky to have got Dr. Ved Prakash Mishraji as the first speaker for having thrown light on the important historical perspective of bioethics from the day of caveman to that of the civilized and enlightened egalitarian man, and also from the point of the various code of conducts as well as the oaths that were prevailing, and the importance of bioethics as a part and parcel of the medical health professional education and also practice in terms of the International Bioethics Code of Conduct evolved in 2005 and declarations from then on till now. And I'm also happy that in 21st century, from 2019 onwards, bioethics is becoming an integral part of health profession education. And not that we were not practicing bioethics before. As rightly told by the earlier speakers, we were practicing bioethics in terms of code of conducts and samhitas, and also various oaths that a doctor used to take at various levels. For me, I have been given a topic that bioethics is no doubt is to be practiced by everyone, and everyone is practicing it. But 2020 has seen a very unprecedented pandemic in the form of COVID-19. And it's probably in the highly civilized materialistic world of 21st century, third millennium, this pandemic has thrown a lot of questions before us. So I have chosen the topic of the impact of bioethics, the impact of COVID-19 on the bioethical practices in health professional education and health practices. With these few introductory remarks, I will share my slides for the benefit of all the august audience. First of all, season greetings from Pravara Institute of Medical Sciences and Pravara family. And I'm extremely happy that the IMA national and international office bearer and Dr. Ved Prakash Mishraji did appreciate the coordination of Srirampur branch of IMA and Pravara Institute of Medical Sciences as the front runners in integrating health practitioners and the health professional educationists to ultimately give importance to bioethics. So with this important component, let me tell you that I would like to spend for next 15-20 minutes on three important components. Namely, on one hand, we have got medical profession. On the other hand, you have got medical education. And on the other hand, you have got COVID-19 pandemic. And in between, there is medical ethics. So today, this medical ethics is challenged both from the point of COVID-19 and also from the modernity of health profession education or health professional healthcare. So I would like to take the components of issues, the impact and the challenges, the issues, challenges, and the impact leading to conflicts and dilemma, and what is the road ahead for a healthy, vibrant human society, and the Pravara initiative as far as the bioethics is concerned in this COVID-19 pandemic era. As you know, this COVID-19 pandemic is unprecedented. It is at all levels, it is at all spheres, and it has totally shattered the lifestyle and changed the lifestyle of the individuals. It is non-discriminative, and it is affecting everyone, rich or poor at the global level, and it is affecting the living process. It is affecting the life itself, both personal as well as public life, and total disruption of life and living is the hallmark of this COVID-19 pandemic. And not only that, it is a threat to the life and living of the future generations. And it is making us to defy all values and ethics, not only the bioethics, but also the human ethics and human values. And it is also affecting governance at all levels, commencing from central to state to that of all aspects. For example, nobody knew the importance of National Disaster Management Act, but only in 2019, we are understanding the importance and horizon of this particular act called National Disaster Management Act. Similarly, because of this COVID-19 pandemic, there is a total confusion. There was a total confusion. We are slowly settling into it. So there is a warlike scenario. We are not knowing where from there is an attack and where to attack and where to ultimately address to. And it was totally disastrous. And it is disruptive. It not only disrupted the economy, but it disrupted socio-psychological life and order. It disrupted economic, trade, commerce, production, technology, education sector, and whatnot. It is also disruptive from the point of cultural order. A lot of cultural issues have been totally changed because of COVID-19. Law and order, governance, and even world order. Because for the first time, you saw international flights being cancelled and the quarantine becoming the order of the day, and so on and so forth. Disruption of life and living process, as I told you. And not only that, it has disrupted the quality of life and the productive life and living. And thus, the very living is questioned by the pandemic. This impact of COVID-19 pandemic, all of us aware, is the lockdown, seal down, containment. These are all the new terminologies that ultimately emerged for the benefit of all the human sector, particularly at the national level, state level, village level. Lockdown, seal down, containment, etc. became order of the day. Closure of all human endeavors, whether it's schools, colleges, offices, shops, hotels, and whatnot. And similarly, ban on travel, transport, hospitality, everything, including the religious centers. Restriction on human activities, including the functions, marriages, ceremonies, rituals, last rites. Probably it is unheard of and unprecedented. And reverse migration. See, Industrial Revolution 1, 2, and 3 brought migration of rural population to urban population, and thus we saw the development of the cities, mega cities and metropolitan cities in 21st century. And you are thinking as to what will be the fate of these urban centers if this migration started taking place. But during this lockdown period, we saw very unprecedented reverse migration by walk, by car, by bicycle, by trains, private vehicles, and whatnot. Unimaginable way of reverse migration started taking place. Even today, it has not come to a halt. We do not know what is going to come. Whether the reverse migration is going to be reverse migration or it's going to be permanent entity, we do not know. And loss of employment, daily earning, and living, particularly affecting the marginal sections of society, daily wagers, laborers, household workers, and even those who are having the middle class income level. And all these aspects, particularly the COVID-19 pandemic, had overload on healthcare sector, agriculture sector, and horticulture. These are the three important aspects which are ultimately having the overload. And slowly and steadily, from March, April, May, June, July, August, we started settling down as to what could be the future of the pandemic. People thought that by September it is going to come down, but it has not come down yet, but there is some control. Thus, after September, we have realized that we must face it and the life must go on, and slowly we are returning to normal life, and the unlocking process in phases is on. But yet there was increase in the cases, there was increase in the mortality, but when compared to the world figures, India was lucky to have very least rate of what should I say, the mortality, though the infectivity rate was high. And there was a cautious approach. Even today we are facing a cautious approach to combat COVID-19 pandemic vis-a-vis education, life, as well as the healthcare sector. And we have started learning to face the challenges. What are the challenges? The virus itself was a challenge. We never knew from where it has come. Is it a animal origin or from which particular place? What is the place of origin? Whether it is mutating, even today it's mutating. What is survival rate and other things none of us knew. And its mode of spread also. Even today, there's a lot of controversy as to what is real spread. Though we say it's a droplet infection, but there are a lot of other theories as to what it could be. So the virus itself is a question. The disease itself, nobody knew. No textbook had any explanation as to what this disease is, what is its etiology, and what is its pathogenesis, what is its pathology, how it can be tested, and what are the clinical manifestations, what are the complications. Even after 6 to 8 months of this pandemic and international level of cases, we are still coming out with different clinical manifestations and complications. Then healthcare, diagnosis was a question mark, treatment was a question mark. Even today, there are questions in it. Then progression of the disease is a question mark. Prognosis is still a question mark. Morbidity is a question mark. Mortality is a question mark. Then health resources of the healthcare, from the point of health professions, healthcare workers, hospitals, wards, beds, ICUs, medicine, PPE, ambulances, facilities, BiPAC, oxygen supply, ventilators, basic communities and medicines. And for information, many of the hospitals started purchasing ventilators, BiPACs, etc. BiPAPs, sorry for the spelling, only after this particular pandemic. Similarly, epidemiology. We do not have vaccine. We don't know what are the preventive measures. We don't know what are the control measures. The only important control measure, as we say today, is wear the mask, maintain social distancing, and avoid crowding, and avoid traveling. And particularly for senior citizens and the young age group, we are telling not to move about. So everything is a question mark. Projection. There are a lot of projections that it's going to come down or go up, but still the projections are either totally negative or totally positive, or we are not in a position to predict what could be the epidemiological status of this particular disease. Then policies and perspectives. As I told you, the government suddenly revoked its Disaster Management Act. Thus, it created law and order problem, demand and supply, particularly of food and medicine, travel restrictions, quarantine, isolation, lockdown, seal down, containment, and unlock in phases, and basic communities are a threat. If these are the challenges, the conflicts. The conflicts were between lawmakers and healthcare providers and professionals. Suddenly, everyone started realizing who has to ultimately bell the cat, whether it's the lawmaker or healthcare provider or professionals. So even today, the conflict goes on. Health professionals versus healthcare workers and support. Who has to touch the patient? Who has to ultimately handle the patients? Who has to do everything? Thus, the conflict continues even today. Health science, health science workers, healthcare, and researchers and health professionals. Even today, every day we come out with a research paper, either negating or modifying or giving a new protocol. Health professionals are totally confused as far as the research trend is concerned. And government versus media, either an suppression or an exaggeration of the facts and the figures. Even today, this particular discussion go on. Then conflicts and protocols. This is where ultimately the health professionals are challenged, whether to hospitalize or not. First, we said immediately hospitalize. After few months, we said no need to hospitalize. Now we say you can be at home also. In other words, within 6 to 7 months, we have seen total change of protocols in terms of hospitalization, in terms of testing, in terms of quarantine, in terms of isolation, in terms of diagnosis, in terms of treatment, and the medical medicine that is being used, the follow-up. Earlier, we used to say 14 days is required. Nowadays, we say within 7 days you can go. So many changes are there. Even discharge policy is undergoing seesaw change. Prevention and control policy is also undergoing seesaw change. Prophylaxis is still a tall order. We do not know when the vaccines are going to come. Research output, as I told you, there are a number of papers even at the international levels where some of the international journals of repute had to withdraw certain articles because of the plagiarism or the cooked up data. In other words, to that extent, there is a challenge even to the research and the publications. Family and community engagement is totally having a conflict as to what to do, what not to do. Then the final outcome of COVID-19 pandemic is not only all these aspects, but it's a dilemma in medical practice, healthcare sector, and medical health practices. It's at all levels and all spheres, particularly medical practice, healthcare sector, and medical ethical practices. Then what is medical ethics and why medical ethics? Already my seniors have covered all these aspects, but let me just give a bird's eye view. See, whenever we talk of a civilized society, an egalitarian society, the rights, duties come into picture, and do's and don'ts also come into picture. And ultimately, we look for the realization of these rights, duties, do's and don'ts. In other words, the code of conduct. And earlier they were natural, later on became constitutional, fundamental. Today we have gone for the human rights level. In other words, it is legal. So we can enforce these things through legal aspects. Then values. Every society from caveman to that of the today modern man, Dr. Ved Prakash Mishraji rightly said, from might is right to that of right is might. Right is the only might. We have come to a level because of one particular system called value system or societal systems, or through community systems, or through social and cultural ethos. So societal, community, social and cultural ethos cannot be forgotten as part of the medical ethics. Then the professional or the vocational ethics. Every profession has an ethics. So also is the medical profession, especially when you are dealing with human beings. Our students also are human beings. The patients are also human beings. The family with which we are attached to is also a human endeavor. In other words, health profession education and health care is one particular endeavor where human endeavor is of primary importance. And ultimately at the individual level, the moral level, the individual conscience play a very, very important role. And all of these are interdependent, complementary to each other. At the same time, they are independent. Sometimes they're independent, but there is total overlap. Next, if you look at the medical ethics, I don't want to go into the details. All of us are aware of it. But for the benefit of this particular talk, let me just review them. See, the first important component is autonomy. So medical ethics ultimately underlines the importance of autonomy of the patient, of the health profession, of the healthcare workers, both at all levels, which includes consent, freedom of choice, privacy, and confidentiality. I'm happy that the earlier speaker said the example of Israel, where a video recorded consent and a doctor speaking to a patient is becoming a must. So you can imagine what is the likely order of the day from the point of autonomy is concerned. Then non-maleficence. In other words, do not harm a patient directly or indirectly. So this again is a very important component. Next is the beneficence. In other words, whatever we do, it should be for the benefit of not only the patients, but also to good of the family and the society. Then justice, fairness, equality, non-prejudice, context, etc. These are the four important cardinal principles of medical ethics that we have been teaching. At the same time, we are advocating. But the question now is, are we following them during this COVID-19 pandemic? Yes or no? The question is, neither we can say yes, nor we can say no, because we are not sure as to what is going to happen. Now, the first dilemma for health professionals as well as healthcare workers is that we cannot strictly adhere to medical ethics. Why? The patient flow far exceeds the resource available, heavy demand for resources and facilities. What is the reality? Lack of adequate resources, facilities, and medicines, both at the government hospitals, private hospitals, public-private partnerships, in terms of the wards, beds, ICUs, ventilators, HFNC, BiPAC, oxygen cylinders, PPE, masks, medicines, and whatnot. Then lack of proper, well-established protocols. Every day there is a different protocol. And we appreciate that the protocol is modified every day. But the health professionals at a tertiary level, a health profession at a rural level is totally confused at times because of the multiple protocols in terms of administration, diagnosis, treatment, discharge, contradictions, and variations. Then allocation of available resources and facilities and medicines become subjective, because when the resource is limited, when the need is more, when the demand is more, then the allocation becomes subjective. When it becomes subjective, naturally the ethical values disappear. Then lack of trained health professionals and healthcare workers and support staff, particularly to manage COVID. But thanks to the health professionals and healthcare workers, we have come as one particular army called COVID army. And today the world recognizes them as COVID warriors. My salutations to all of them who took the challenge on its in letter and spirit. Then allocation of available health professionals and healthcare workers is again subjective. Who has to work, who should not work, when the rest is to be given. It's mainly because of heavy density of workload, burnout, worn out, moral distress, fear psychosis, separation from family, risk of infection, and protection to family. A nurse or a person will ask, yes, I'm ready to do the COVID duty. Who will take care of my family? Is there any insurance for my family? It's there in the government sector, but what about the private sector? These are the issues. Then the first dilemma we face is lack of timely decision and clarity of policy, contradiction among administration, precedence of lawmakers over the health professionals and healthcare workers. In fact, the lawmakers are going to decide more than the health professionals. Probably we have to have a balance in this. Diverse healthcare systems. There are a number of pathies. Every pathy say that we have a Ramabana or we have a treatment, but no one comes out to conclusively as to this is the real medicine for this one. In other words, people are totally confused. Lack of effective treatment line, disruption of private clinics, nursing homes, family physician concepts, diverse research output and outcome. I already told you. Differential approach to rich and poor. If you have got 10 lakh rupees, you can get yourself admitted to a sophisticated hospital. If you don't have, nobody is there to take care of you. To that extent, there is discrimination. Tall claims and false claims. As I told you, even at the highest research level and institute level, there are tall claims, there are false claims, which are to be retracted at later stage. So, in other words, for COVID-19 management as well as bioethics, much is unknown, less is known. And we are almost working in dark, and we are searching for an elephant in a dark room. Then the second dilemma is there is no clear information to people on admission and treatment. The patients are running from pillar to post. No hospital directly takes them. There are so many other hurdles. There are so many protocols, and they are shown different hospitals, COVID, non-COVID, and other things. And thus it enhances the morbidity and mortality. No clarity and decision making on admission and treatment. Even some of the VAPs also had this particular difficulty. Testing and confirmation also started. In the earlier days, it took minimum 3-4 days. Thanks to the establishment of the new ventures, today within 24 hours we are able to give the results. This leads to lack of proper timely treatment during that waiting period. In other words, in our medical practice, we say first 1 hour is a golden hour. Are we not missing this golden hour because of COVID-19 pandemic? And are we not putting the patients at risk? And regarding the affordability of treatment at private hospitals, no doubt there must be a channel of income for the private hospitals, but can it be branded by the public as exploitation? See, again, there is a dichotomy. We say that this resource is a must, this revenue is a must. The patient questions as this much is required or not. In other words, we have to strike a balance between what is accepted and what is projected. Then at the hospital, as I told you, distinction between COVID hospital and non-COVID hospital, COVID suspected and COVID patient, and seeking emergency care, to admit or not to admit or to refuse. For people, where to go, to which hospital to go. With health professional, to treat or not to treat, and how to treat. For example, if a person comes with a heart ailment, etc., the first test is to be tested is whether he is COVID positive or negative, then only is admitted. Then what about his ailment, important ailment? What is it, golden hour we are going to lose? Then to treat or not to treat, and how to treat. With old patients, in fact, this is one of the important threats to medical profession or medical ethics. There are old patients of cancers and old chronic diseases, but what is happening to them is a question mark. Particularly geriatric, neonatal, pediatric, obstetric and chronic diseases are totally compromised. Thus, according to this is my personal opinion, breach of schedule of treatment for chronic patients to go to treatment or not to do treatment is the choice for the option in choice for the patients. To give treatment or not to give treatment is the option in choice to the doctors. In other words, procrastination has become order of the day. This is a Shakespearean word. Procrastination, to do or not to do, is becoming a buzzword in case of COVID, when it is especially true of medical bioethics. The third dilemma is when to shift a patient to ICU. when to put the person on ventilator, and when to continue, how to continue with ventilator, when to remove the ventilator because of the demand, and to whether to withdraw life support, at what stage we have to withdraw. These are all the question marks and dilemmas. These have led to rationing, prioritization, and prediction of ICUs, beds, ventilators, life support, medicine, and healthcare. Thus, according to me, there is total compromise on the 4 principles of medical bioethics, and thus the total decision making and family-centered ICU care is put to a question mark. Then the 4th dilemma. This is a very, very striking future. Total separation of patients from the family. 25 years of research stated that patient-family interaction enhances quality health care and prognosis. This itself is a challenge today. What are the expectations? But what is happening? Visit by family members in interaction and support, denied. Family-centered healthcare, denied. Doctor-patient relationship is broken. Family-patient relationship is broken. Communication of patient, family, doctor not clear. Informal consent autonomy compromised. Justice, fairness, equality, equity denied. Dignity and honor of in death is compromised. This is in fact a very, very shocking thing. And family interaction during dying time totally compromised. The family members will not be near to a patient when he is dying, and he will not be able to speak to the family members during the last breath. Communication of news of death to relatives also is compromised. Sometimes there are cases where after 3-4 hours the families come to know because of these rigid protocols. Then dignity and honor in last rites is also compromised, whether it's the richest of the rich or poorest of the poor. There are a lot of issues regarding the dignity and honor of last rites that is given to a departed soul. That's autonomy, beneficence, non-maleficence, and justice. All the 4 cardinal principles of medical ethics is compromised because of COVID-19 pandemic. That the question is, why the compromise? Fear of spread, fear of isolation, fear of surgical trauma, fear of social stigma, and panic situation. I was reminded of an anecdote where when a doctor was treating all the patients, he was considered as a COVID warrior, and he was given a floral welcome. But when he became the patient, the first person, the entire members of the flats, they said he should not stay here. He should be taken out of the clinic, the flats and so on. In other words, social stigma, social trauma, not only the patient, doctors, as well as the family, is really costing too much. And it's at the cost of humanity and medical ethics. Lack of clarity, protection, assurance, unlocking process is already on, opening of activities is on, entertainment, religious places are still a question mark, opening of schools and colleges. In fact, students are panic, parents are panic, when the college is going to open, when the colleges are not going to open. So in other words, there is no clarity. And all these clarities leading to stress and anxiety and whatnot. Then possibilities, increasing cases, community spread, need for increasing healthcare facilities, need for medicine, food and availability, etc. These dilemmas have led to the defying or breach of medical ethics and principles: autonomy, beneficence, non-maleficence, justice. Number of task forces at WHO, UNESCO, as well as at national and state levels are involved in addressing all these issues. But the time is running out. Let us hope for the better. Let us be optimistic. As I told you, we can and we will. Definitely will address these issues. It has come as a challenge, and thus there is a need to redefine, redraft bioethical principles in the view of COVID-19 pandemic. That's the entire essence of my particular lecture. In other words, bioethics, what it was, what it is, and what is being practiced needs a thorough review in terms of COVID-19 pandemic. Emergence of new protocols now naturally are coming up. Naturally, you have to follow them for isolation, treatment, rehabilitation, quarantine, promotion of health, and preventive measures on monthly, weekly basis, sometimes on daily basis. Then there is a need for remodeling of world order, living philosophy, luxury or living is a question mark, purpose of living, service to humanity, question mark, meaning of life, live and let live. It should be the order of the day. Addressing psychological aspects, stress, anxiety, depression, complexity, pessimisms, enhancement of and augmentation of healthcare. Then we will overcome corona or live with it, no doubt. But slow but definite revival is possible. Let us be optimistic. We should give importance to the thrust for minimum spending and maximum savings and maximum good human relationship. Thus, we need the support of government, NGOs, and global agencies, as well as the private public partners, as well as at the community level. Friends, today there is no choice, but it's a compromise. and the art of the day should be caring and sharing. And we should not compromise with the bioethics, but on the contrary, we should highlight the principles of bioethics, and as far as possible, we should try to stick to it and ultimately go for it. At Pravara, we have taken a lot of initiatives thanks to our benevolent management. We are indebted to our chairman and the president of Pravara Medical Trust, Dr. Rajendra Patilji. Though there was no government order yet, as early as June, we started a Pravara rural hospital, COVID hospital with 100 beds, with all the facilities. And so far, we are able to treat. Then the government considered our hospital as a non-COVID hospital. So the Pravara COVID hospital continued to serve the rural areas, and everything is free. And because of that, we have got enable accredited COVID testing laboratory, where you have got TrueNat as well as the RT-PCR mission, and also the other methods of testing, so that within 8 to 10 hours, we are able to give the results. And we are giving free of cost all the facilities to the the patients. And all the campus also is having all the facilities round the clock, so that we feel that there is as if there is no lockdown on our campus. To that extent, we are indebted to the management, and we are also indebted to our health warriors and the health professionals, and also our residents and students of our campus, the parents and the students. And friends, I would like to conclude by showing this particular picture. I'm depicting two particular photographs which came in my WhatsApp. One was from a tribal area, where by realizing the importance of wearing a mask and so on, you can see tribal people covering their face and the nose with the help of the leaves. This is where we have to reach. This is an area of concern. We are yet to reach out to them. The second photograph shows that the boy doesn't mean, it doesn't mind becoming a naked person, but he's protecting himself through a mask. In other words, these are the two photographs which has really stirred my conscience. Where exactly we should reach them. And there is a ray of hope, and things are improving. I'm sure the health professional on one side, the health education is on the other side, and the governance on the third side ultimately converge together with 3 PPP models to ensure that during COVID, best of the healthcare is given to the patients. At the same time, there is no compromise on medical bioethics. Looking forward for emergence of redefined, well-defined biomedical practices for days to come. I thank the organizers for this particular opportunity. Thank you very much.
Thank you, sir. I think there are 5 questions for the. There is one question. I think I request one sir to answer that question. Bioethics and medical ethics should be an integral part of a doctor's life. Dealing with dilemma should be taught by experienced seniors. That question is asked by Neha Mehta from Mumbai.
Yes, extremely true, and we entirely concur with the view expressed by Neha, and that is why right from the medical education stage to the practicing stage, we are trying to reach out to everyone through the IMA Bioethics program, so that the ethical issues and the ethical dilemmas, especially the current dilemmas which keep on coming. Today, we all are worldwide discussing the ethical dilemma regarding euthanasia or physician-assisted suicide. Now, there is a worldwide debate on that particular issue. Assisted reproductive technology, surrogacy, end-of-life issues, all these current ethical dilemmas have to reach to each and every practicing physician. And that is why Indian Medical Association also, whenever we give credits, we give double the credits if there are ethical topics included in that particular CME. And I am sure that Maharashtra Medical Council and other state medical councils will also follow this pattern of giving double credit hours to topics where ethics are discussed. Thank you.
I think there is one more question. I think I request Jayaraj sir to answer that question. Should value building not be a combined responsibility shared by parent, school, college, and institution?
Yeah, in fact, that's what I told. Bioethics, medical health profession education cannot be seen in isolation. Medical bioethics is not just confined to only a medical practice. It involves government, involves all stakeholders, including the patients and the relatives. Only when everyone is aware of what are the do's and don'ts, what are the standard protocols acceptable to everyone, properly the dilemma will disappear and the compromise will disappear, and there will be only one choice. The choice is that, yes, I am getting the health care and health medical care to the best of my ability, from the best of the ability of the doctor. In other words, there is need for convergence of all these. Now we are seeing in isolation, attack on doctors on one side, and telling that doctors are negligent on one side, and we are telling that the patients are not cooperating, and so there are a lot of legal issues, the social issues, psychological issues involved in this. So it is not just that easy as we just profess. In practice, there are a lot of dilemmas, particularly for the doctors who are there in the casualty, the young doctors. And the recent scenarios of the vandalization of the hospitals, etc., beating of the doctors, etc., they are all eye-openers. And even the media is also showing a lot of hype. So there is a need for restraint on all these aspects. So it not only requires bioethics education to health professionals at the practitioner level, at the college level, at the university level, but also to the public. So there is a need for involving NGOs also in this particular aspect. So next, probably this is an initiation. Next time when we conduct a webinar, we'll be involving health profession, IMA, university, at the same time we take an NGO also, so that there will be convergence of all the three stakeholders.
May I add something to what Professor Jayaraj has said?
Yes, sir. Yes, sir. Please.
First of all, let me thank Professor Jayaraj that in spite of being a medical administrator and academician, for showing his great concern for the most biggest issue which the fraternity faces, that is the violence against the medical professionals. No doubt, strong legislation definitely acts as a deterrent, but these are social crimes and they need to be addressed at a societal level, where convergence of all the stakeholders together is a necessity. Today, the medical professionals have to understand that no longer exists the patriarchal vertical system of medicine where the doctor says a thing and the patient blindly follows it. Now it has become a horizontal system where the patient is supposed to be an equal partner in his own management. And that is why the need for person-centric medicine has come up in a big way on a global scenario. And if we are going to have a horizontal relationship, cornerstone becomes ethics, I am sure the incidences of violence will automatically decrease. And important aspect, the patient also has to understand the limitations of the medical science,
Yes.
the limitations of the doctors in treating in given circumstances, and that medicine is not still a perfect science. It has its own limitations. Whatever we see on the internet.
Thank you, sir. Thank you, sir. There is one more question. I think that will be the last question. That question is asked by Megha. Patient and doctor and all health professionals need proper counseling and support by government and respective hospital and institution so as to give their best and still strong, maintaining their own family health and their work same times. I think I request Jayaraj sir.
In fact, the question has the answer itself. I'm happy that the candidate, the delegate has given the answer itself. It's a very good answer. As I told you, there is a need for convergence of not only the health professionals on one side, the educational sector on the other side, the non-government NGOs on the other one, but she has added a fourth dimension that is called the government also. In other words, we should all sit together and say do's and don'ts, and we should know the limitations and the same expectations. So whenever the limitations and expectations match, there is no violence. Whenever the expectations are more and limitations are less, limitations are more and the expectations are more, then there will be a clash. So particularly when there are conflicts, the conflicts are going to increase. So COVID has taught us a lesson that there is a need for educating people on the importance of health profession education, health practice, at the same time the ethics. So naturally convergence is required. I fully agree with it.
Thank you. Thank you for all the speaker, Dr. Ved Prakash Mishra sir, Dr. Vankade.
Can I, if Chairman sir permits, if Chairman sir permits, can I ask one last question?
Yes.
Yes. Yeah, this question is to Dr. Bonwe sir, although he has opted out from this panelist, but he is still a panelist for us. Bonwe sir, are you there?
You can go ahead and ask the question. Even if Avinash is not there, I will try to answer.
Yes, sir. Yes, sir. The question is how to deal with the ethical dilemma of the gap in the healthcare between rich and poor.
That is exactly what all the panelists are harping on, especially Professor Jayaraj has very nicely elucidated on it, that this is not only a scientific issue, but a socio-economic issue. And this gap is very, very prominent in developing countries like India. And that is why we need to accept the fact that given that is one of the ethical dilemmas, allocation of scarce resources.
Yes.
If we have only 1 rupee, should we spend it more on the primary healthcare or on tertiary healthcare? That is the issue. Should we have an insurance-based model, or should we directly strengthen our public health infrastructure? All these issues are integral part of dealing with these ethical issues. Thank you.
Thank you, sir.
I think that topics that is concerned with the ethics in medical professions, education, ethics for bioethics for the medical professionals, and bioethics in a COVID-19 pandemics. All these topics or aspects of the topics that are covered very well by all these speakers. The two things are there that we are deliberated during the whole 1 hours. One point that is raised about the informed consent, and second is about the ethics. Basically, as far as the law is concerned, there is no legal definition as far as the ethics is concerned, and there is no legal definition for consent is concerned. So, since many years, actually, I was wondering for the legal definition as far as consent is concerned. Just there is mentioned in the Indian Contract Act. So, we thought on that aspect, and we reviewed many judgments that they are given by the Consumer Court, Supreme Court, or High Courts, and we came to the conclusions about the elements of the informed consent, and that will be the guide for the medical professional. Second, as far as ethics is concerned, also there is no legal definition of the ethics. These are moral principles laid down by the respective council for the professionals since long times. So these are these both things that they are very important as far as the medical profession is concerned. So I wrote a book on informed consent in medical professions. Same thing that what I mentioned, what things are required during the professional practice. Second book that we wrote along with Dr. Thetme and Dr. Sandeep Mane, Beyond Medicine, A to E for medical professionals. That what you have discussed, that is attitude, that is more important, behavior, that is also important, communication is also important, and doctor-patient relationships, and things. So Beyond Medicine, A to E for medical professionals. The purpose was to bring out all these things before the medical professional. And again, one more book that we are trying to write, that is mostly at the stage of completion, Being Patient, A to E for patient and relatives. So just someone mentioned that ethics, Jayaraj had mentioned, it should be that for patient also. So same book, that is on same parameters, that is Being Patient, A to E for patient and relative. That book that mostly that will come in 15 days for all of us. And the 5 chapter, that is A, attitude, analysis and assessment for the patient's attitude. Second, behavior, that is a modification that is required on the part of patient. Third, that is communication, that is trust building on the part of patient, that is important. Fourth, that is the doctor-patient relationship. That is because when we think about the behavior of the patient, trust is most important, because now the parameters, that is the trust development between the doctor and patient, that is also important. And ethics for patient, not only for the medical professional, ethics for society. So as far as the ethics is concerned, generally 2 aspects are there: ethics for professionals, medical ethics for professionals, and ethics or moral values for the society, that we have covered in the chapter 5. And I think that what Jayaraj mentioned, that is it is not only that we can make aware the medical professionals, but there is a need to make that awareness amongst the society, among the population. Then only that conflicts or the assault on the medical professionals, that conflict can be avoided. I think time is over. I am again thankful to all the speakers for giving excellent speech on all the concerned topics, and I am thankful to the organizer for giving me an opportunity to chair this session. Thank you.